here. I'm trying to join this grade level reading webinar. I have so much to do. Hold on.
Thank you, everyone who has just joined us from the waiting room. I'm just going to give it a couple more minutes as people filter through. So if you'll just hang in there with us, we'll begin shortly. All right, everyone, I think we're going to go ahead and get started. I'm sure people will filter through as we begin, but we have a lot of content today to cover, so I want to go ahead and start us relatively on time here. Welcome, and thank you all for joining today's webinar, Community Solutions to School Readiness in the Time of COVID. We are pleased to be co-hosting today's webinar with our longtime partner, Campaign for Grade Level Reading, and we will get to their wonderful content here very shortly. I just wanted to go over a few sort of introductory remarks for those of you less familiar with the National Civic League. We are a 125-year-old nonprofit, and we are focused on advancing civic engagement to create more equitable and thriving communities. Our core work revolves around community assistance, awards and events, and research and publications. For community assistance, we help the communities directly with strategic planning and things like city charters. We are probably most well known for our flagship program, which is the All-America City Awards. That is actually going to be happening next month. We're focused on health and well-being this year, and due to COVID-19, we will be having that event virtually. So if you've always wanted to check that out, but never wanted to travel all the way to Denver, we will have open registration. I'll send that information out later if people are interested. We'd love to have you join us. And then our last main bucket of work, if you will, is our research and publications, as primarily our National Civic Review, which is a quarterly academic journal, and then our Promising Practices database, where we share good stories coming out of communities who are doing work to improve lives. And then our Civic Index, which is used for communities to kind of gauge how well they're doing on a couple of civic engagement components that we have. All right, so before we get started, I just have a couple of housekeeping items to go over. Everyone is on mute right now, and we ask that you stay that way to avoid background noise. We will be taking questions and answers at the very end, so feel free throughout the program, if you have a question, to go ahead and enter that into the chat. I'll keep track of those, and then we will have our panelists address those at the end after each of them has had a chance to give their prepared remarks. We are recording this webinar, and I will be sending both the slides and the recording and a brief survey after the webinar. So be on the lookout for that. If you have to jump off, don't worry, we'll make sure that you get the recording. And that's all I have. And I want to now introduce our moderator for the day, Ron Fairchild. He is the director for the Support Center with the Campaign for Grade Level Reading. He's also the president of the Smarter Learning Collaborative. Every few years, many of you know that we collaborate with Campaign for Grade Level Reading for a themed All-America City Award. That's not coming up for another couple of years, but we like to keep that relationship and that collaboration alive in the intervening years through collaborations such as this webinar. So I'm really excited for Ron and all of our panelists who have joined us today. And with that, let's go ahead and get started. Ron?
Well, thank you, Rebecca, and I want to just say thank you to everyone at the National Civic League for being a founding partner in the Campaign for Grade Level Reading, and for all the great work that you do with communities all across the country on civic engagement. I want to first just say to all of you, thank you also for joining us today during Grade Level Reading Week. I want to wish everyone a happy Grade Level Reading Week. Like many organizations, we found ourselves in a situation where we weren't going to be able to gather this year as we originally planned in Washington, D.C. for a large national gathering. And instead, we pivoted rather quickly to a series of events that are happening all over the country this week in states and in local communities that really celebrate the importance of the critical milestones around early school success and the campaign's effort to disrupt generational poverty by focusing on one of the earliest and best predictors we have for future success in education. And I think it's fair to say that now more than ever, we really need to tap into the spirit of innovation, invention, improvisation that we're seeing in local communities all across this country as we really redouble our efforts to close gaps and to address issues that are preventing, issues and barriers that are preventing so many low-income kids from hitting that critical milestone. So I'm delighted that you've chosen to join us this afternoon. I'm also thrilled to introduce our three panelists. You know, the goal of the session today is to really give you some actionable information that you can use. This session is designed really to help you get some insight into what's working in communities across the country to hopefully prevent folks from reinventing the wheel or starting from scratch or engaging in duplicative trial and error. There's enough work to do right now without any of us engaging in that. So our first presenter today is Bess Jamie, who is at the United Way in Lane County, Oregon. Bess is the Director of Education there. Lane County's been part of the campaign since its inception. They've held the distinction of being a pacesetter community multiple times. And Bess is going to share a little bit about their work with the KITS model, which is the Kids in Transition to School, and their efforts to steadily scale that and grow that across Lane County over the years. So thrilled that Bess is joining us today. After Bess, Christian Buggs, who is at the United Way in Nashville, focused on literacy partnerships there at the United Way. Christian's also a member of the school board in Nashville. And Nashville is one of our newer campaigns. They've joined the campaign in 2017. And in addition to all of their work in response to COVID, Nashville also has demonstrated a tremendous amount of resilience in the midst of the COVID-19 pandemic. Have also been dealing with rebuilding after a series of really devastating tornadoes that hit that community. And so Christian is really going to talk to us a little bit about their work in that kind of context and the ways in which they've partnered with the school district, the library, and other organizations to deliver virtual programming for kids and families that are so needed right now. And then third, and last but not least, is Jennifer Deemer with the United Way in Wyoming Valley in Pennsylvania. And for those of you who aren't familiar with Wyoming Valley, that's kind of the Wilkes-Barre and surrounding areas in Pennsylvania. Jennifer and the team up in the Wyoming Valley area joined the campaign back in 2016. And Jennifer's here to talk to us, among other things, about some of the innovative work that they're doing with Highlights Magazine. And she's the VP of Community Impact there at the United Way. So you're in very capable hands. Each of our three presenters are going to give us some brief remarks, probably 10 to 12 minutes. Then we're going to have plenty of time for questions and answers. I would encourage you to include those in the chat, as Rebecca mentioned. And with that, I'd like to turn it over to Bess, who will kick us off. Bess?
Okay, thanks, Ron. I appreciate the introduction, and it's my pleasure to be here with you all today. As I get my slides queued up, I just want to orient everyone to where I am geographically. So as Ron mentioned, I'm from Lane County, Oregon, which is our main metro region is Eugene and Springfield. Eugene is home to University of Oregon, go Ducks. And the rest of the county is about the size of the state of Connecticut. So it's large geographically, but it's mostly rural other than the metro area of Eugene and Springfield. So that's where I am. And as I said, it's a pleasure to be here with you today and talk about the KITS program that we've been working with the developers of the program for the last really decade and have been able to scale it across our county. So the Kids in Transition to School program was developed by a group of social scientist researchers from the Oregon Social Learning Center, which is based right here in Eugene. And it's a very robust and evidence-based and tested model for helping kids start right on the right foot as they enter kindergarten. So today, my hope is to really describe the program to you and tell you more about it and what the approach is, talk a little bit about the data and outcomes so that you can get a sense of the effectiveness of KITS, and then really to talk about sort of the modifications that we've made in the intervening weeks as we've all grappled with the impact of COVID. So recent headlines from educators across the country really paint a pretty bleak picture in terms of student readiness to learn when they enter kindergarten. And this seems to be getting sort of worse over time. Locally, we're hearing that young children coming to school really don't have the behaviors necessary to pay attention, to regulate their feelings and behavior, and to get along with their peers. These social emotional skills are sometimes termed soft skills, but we really argue that they are foundational to a student's educational success. So in fact, kids who enter school with solid self-regulation and social skills do better across school in academics and are more likely to graduate and pursue higher education. And we know from the research that as adults, they're likely to have better mental and physical health, and they're less likely to be involved in criminal activities. So the central question that we have asked and continue to ask ourselves is, how do we ensure that all kids start kindergarten ready for success? And our answer to that question here in Lane County is KITS. And the reason why we know that KITS is so successful is that it takes a really a holistic approach. So it's a program not only for kids, but it also involves the parents and caregivers. It sets teachers up for success through extensive training and coaching, and that eventually sort of bleeds out into the entire school community. And sort of the secret sauce to KITS' approach is that it's strengths-based. It's not about shaming, blaming kids or parents. It's really about focusing on what they're already doing well and teaching them new skills, how to and what to do, not what not to do. And all of that is based in both research, child development research, behavior management research, and has been tested thoroughly by the social scientists at OSLC, Oregon Social Learning Center. So when we think about what KITS looks like in action, just to give you a sense of how the program is delivered, essentially there's a school readiness group, which is the kids, and then a concurrent parent group. The kids meet for 24 sessions over the course of between 8 to 12 weeks, depending on how the school wants to run it. And the parents meet for about 12 sessions. All of the curriculum is sort of packed into that model. And the way it's delivered, whether 8 to 12 weeks, is somewhat dependent on how the school wants to do it. During those times, foundational social emotional skills, including self-regulation and pro-social behaviors, are taught and practiced, and with some introduction to some early literacy and numeracy skills. So these are 4-year-olds entering kindergarten, and every day they get to have a lesson around what to do, and then have time in between those classes to practice. And the parent group is set up very similarly. Another one of the really effective components of KITS is that there's a very low student to teacher ratio during these classes. So for every 6 to 8 kids, there's 1 teacher or educational assistant. And so that the kids get a ton of one-on-one interaction with the teachers, and the teachers are calling out good behaviors as they're seeing them. Not very much gets under the radar during these classes. So there's just a lot of individual attention and instruction. And then it's activity-based learning, and then they have time to practice of new skills for both children and parents. So the principles for the kids is really, like I mentioned, sort of to build on their strengths, what kids are already doing well, what they're showing, exhibiting behaviors that are already working in terms of sharing, cooperation, getting along with their friends, sitting still. They really focus on what to do and what not to do, because we know kids hear a lot about stop, don't, and this is sort of flips that on its head. They model the new skills, they practice them, and then they positively reinforce them. And so these kids over time start to really understand what it is that they're being expected to do and how to do it well, and how to control their bodies and control their actions, and they can teach each other as well as they start to learn them and call each other out for their behaviors. For the parents, these are 12 group sessions in which everyone is welcome to come. All grandparents can come, aunts and uncles that have a prominent role in their children's lives, anyone that really touches that child every day and helps parent them to whatever extent that they are. It's a really supportive environment. Again, it's the parent group facilitator is there to call out what the parents are already doing well. There's no shaming or blaming. And it also is teaching them, evidence-based positive parenting skills. Leads to the parents feeling better about where they are and confidence in where they're going to help teach their kids to get ready for school. A big part of the parent group is that they are at the school attending this group. And so it's connecting the parents physically to the school, and the parents can meet administrators and teachers and start to begin that involvement in their child's education, which we know is another predictor of school success for kids. And then of course, they're trying to lower barriers to attendance by providing childcare for younger kids, transportation, and snacks. The third leg of the KITS stool is really teacher professional development and training. And so there's comprehensive training in the KITS curriculum and evidence-based classroom management techniques that happen for teachers. There's coaching throughout the entire implementation for the first few years of the KITS team that's in place. And this is weekly coaching with the entire team, including teachers, EAs, IAs, administrators, site supervisors, bus drivers sometimes, the parent group facilitators. So it's a team approach. They video the classes. They talk about what went well, what needs to change. They talk about the individual needs of the students. And so the teachers get really enmeshed in the program, and so that they can, by the time they're done, they really understand how to work KITS in their classrooms throughout the entire year. Okay, so I just want to share a little bit about the outcomes that we've seen from KITS and talk a little bit about the effectiveness, because we really do, we've invested both time and a lot of money in scaling KITS across Lane County, and we do it because it's so incredibly effective. So KITS has gone through 3 randomized clinical trials, and that has been conducted by the Oregon Social Learning Center. And the results have shown that across those studies that KITS had positive effects on children's literacy and self-regulation skills, that parents are also showing better parent skills, and they have increased parent involvement in their child's school. And then the teachers go on to say also about the impact it's had on their classrooms, and I'll talk a little bit more about that in a second. But one of the $64,000 questions for early education programs is whether the effects last. And so the KITS team has studied these students through 5th grade and beyond. And what they've seen so far is that there is evidence and effects that show better self-competence in reading in 3rd grade and better academic achievement and self-regulation at 5th grade. And they're continuing to follow a group of students that were in foster care that are just getting ready to graduate, and to look at long-term KITS effects all the way through graduation. So that data is going to be exciting to see as well. So essentially, we have known from the KITS studies and the data that they've collected that well-prepared children will model success for their peers, that engaged families with positive parenting skills will send well-prepared students and support their schools greater than their peers, and teachers who feel prepared and supported will use their skills and knowledge with other students and share them with other educators, which is sort of how it starts to build that school community. So in terms of parent caregiver reports, we see effective, results in parents feeling more prepared to support their kids' learning, that their children are more comfortable and ready for kindergarten, and that the parents feel more welcome and connected to the school. And the teachers report that when we asked KITS returning staff about their last school year, 100% of them had used KITS strategies in their classrooms throughout the school year. So that summer training and learning that they had done, there was a through line throughout the entire school year. The vast majority of 83% believed that their kids were better behaved because of the strategies they learned from KITS, and over 90% felt that it had been a better year for them because of KITS. Over time, more teachers get involved because it doesn't have to be just the kindergarten teachers. Anyone can be a KITS teacher and get trained. Those effects then go into third grades and fifth grades and second grades. And so the school kids, the kids throughout the school start to learn these behavior management techniques, and they start to actually call each other out on them. So it's pretty cool the way it works across the school. So I've given you a lot of information about how KITS runs normally, and we all know these are not normal times, and that we all have had to make modifications and adjustments in the time of COVID. And so one of the things that the KITS developers at OSL did right away was to modify their parent group component to really focus on online delivery, virtual delivery, so that they could at least interact with the parents and start to teach them some of the positive skills in a more regular manner, so that they can meet weekly online and be able to practice the skills at home. So they developed their kits at home, and then the 100% delivered in Spanish version called Kits en Casa. And again, this is a virtual online parent caregiver group. It's to encourage and support learning at home. It's to help the parents learn how to teach their kids to follow directions and to cooperate using the same evidence-based behavior management strategies that the kids would learn in the classroom with the teacher. It's really to support their kids to develop their social emotional muscles and skills that they need to be ready for school. And it's specifically designed to meet for an hour twice a week, so that parents have time to practice these things with their kids in between. And it runs for about 8 weeks. And currently we are running kits at home groups with about 200 parents. I'll say the other modification that we've made is that a couple of our small rural districts in Lane County, which have very, very low case counts, are doing in-person school readiness groups. And they're just adhering to our statewide childcare guidelines, health and safety guidelines that have been modified for COVID. So these are maximum group sizes of 10 kids. It's a stable group, meaning once they start, no kids can join, and no teachers can join. So it's the same group of kids and parents weekly. And they are doing virtual parent groups and virtual coaching and training of the staff. So a couple of our smaller districts have decided just to go forward and do it anyway. And that's been successful for them because they have good relationships with the communities and parents. And it's been important to them to continue to do that. And then the last thing is that we're really exploring about what we could do to potentially embed kits in the first 8 weeks of kindergarten. So there's a twofold benefit here. One is that we're able to teach the entire kindergarten staff of the school, but also that all the children attending kindergarten received a KITS curriculum, because one of the downsides, I guess, of KITS is that it's only available to children during the summer. And so those that are able to attend, so they need to be able to attend the majority of the 8 weeks. And so if kids are going to be on vacation for 3 of those weeks, they wouldn't be able to attend KITS. So this gives a chance to actually get more kids through the program. And we train the entire school and bring in some additional EAs and things like that. And it's actually, we think, going to be more cost effective for districts to deliver KITS this way. So we have done a pilot project with one of our metro area schools, and it was a really, frankly, a wild success. And so we're talking with districts about what that might look like. And there's a lot of interest there because the teachers and the administrators in these schools are saying, we think kids are going to need KITS more than ever, since there's been such a gap in time since they've been in a structured classroom environment, and a lot of anxiety for kids and unknowns and family challenges. And so when they come into school, when they're able to return to school, they're going to have some behaviors that are probably going to reflect some of that uncertainty they've been experiencing, and wiggly behaviors, and just need a lot more concrete instruction about behavior management. So we are exploring that and hoping to extend that into at least 4 or 5 more elementary schools this fall. Okay, so I know that was a ton of information, and I welcome you all to visit the KITS website. I'm happy to answer questions as we go through this today, and I just thank you for your time and for the opportunity to share more about this great program that we've had in Lane County. Back to you, Ron.
Wonderful. Well, Beth, thank you for a fantastic presentation. I wanted everyone to have a chance to hear from a community that's been doing this work for 10 years to get randomized control trials. But they're not so locked into that research or evidence-based model that they're not innovating in this current environment. And so kudos to you and your team, Beth, for such great work. And I know there's a question in the chat. I would encourage you to respond to that question. And then we're going to move on to our next presenter. So Christian, tell us a little bit about the work in Nashville.
Sure. Thank you all for having me here also. I'm going to go ahead and share my screen. All right. So yes, I am Christian Buggs. I am the manager of, there we go. I am the manager of literacy partnerships for the United Way of Greater Nashville. And I do just so happen to sit as a school board member for Metro Nashville Public Schools. I appreciate the previous presenter, Beth, kind of explaining what her community looks like, because I think mine is just a bit different also. Here in Nashville, we have about 1.2 million people, but our Metro Nashville Public School System serves 86,000 students, and we do that by supporting 11,000 employees. So a very large urban district where 145 languages are spoken across 167 schools, 4 of which are academic magnets, about 30 which are charter schools, and the rest traditional zone schools. The blueprint was actually developed, or we began research for it in 2017 under our then mayor, with the goal of doubling the number of students reading at grade level. We had one of our area universities, Luzerne University, to do some deep dive research, look at best practices around the country, and they actually looked at what was happening with the campaign for grade level reading. And they landed on these 6 recommendations. Doggone it. I'm sorry, me and technology. So they landed on these 6 recommendations. We wanted to make sure that we strengthen birth to age 3 supports. So what happens as soon as a child is born until age 3? Are there health collaboratives that we can work with, or health departments? Just everything, birth to 3. Then we wanted to improve quality and access to pre-K. We have so many different daycares, early learning centers, or even in-home daycares, but we've never had a true needs assessment as to how many seats we need, what quality standards might look like, or how you can better support a daycare. Next, we wanted to strengthen the district's ability to meet student literacy needs. So the blueprint for early childhood success is a collective impact model, meaning we are driven by the community. Our goal is to not have one person or one single entity fundraising or championing this work, but we want it to be all inclusive. So we want to move alongside the district, not mandate anything that they do, but make sure that we're bringing the community along for the ride. Next, we wanted to substantially reduce chronic absenteeism. And I'm sure we'll have so much to talk about next year considering COVID and our moving to virtual learning, because how exactly do you track absenteeism? Or is that even something you worry about when students have gone 6 months without seeing their peers or their teachers in person? But that is something that in the old normal that we wanted to keep track of. But the two that I'll focus on today are the last two: stemming the tide on summer reading loss and better maximizing out of school time, and then just raising public consciousness of our problem and the urgency of, around literacy. In Nashville, roughly 28% of our third graders actually read on grade level. In comparison though, about 35% of our kindergarten students come into school one grade level behind. So we saw the need early on for a birth to grade 3 collaborative impact community investment or initiative. To specifically attack summer reading or summer literacy loss, we developed what we call the Summer Reading Partner. With over 100 community partners, we're actually spearheaded by the Nashville Mayor's Office, the Nashville Public Library, Metro Nashville Public Schools, and a group called Alignment Nashville, which strategically helps to develop mission, vision, and core values for organizations. And they look to better support collective impact efforts. So again, I think it's important to note that we've been very intentional over at least the last 2 years, just building community buy-in, making sure that there is a true community effort. And the idea that the mayor's office and the public school system are both kind of at the helm here is really important and drives our work because it gives it a sense of validity. So we know that this summer was different. So let me take you back to 2018 and 2019. We wanted to make sure that we did a landscape analysis, and we looked at all the different summer programs, camps, daycares, anyone that offered any kind of summer or enrichment. And we asked them to embed 20 minutes of summer reading time. Once they made that commitment, we offered a 2-day training, and it didn't have to be 2 consecutive days or even 2 full days, but we offered 2 days of training for staff and for executive directors to make sure that they understood how to appropriately choose books. We wanted to make sure that they were connected to the library and other community organizations that focused on access to books and building libraries, and just making them feel comfortable interacting or engaging children around 20 minutes of reading each day. We wanted to make sure that students would read at least 600 minutes over the course of a summer. That was our initial goal, and I think it was because 20 minutes over the course of a certain period of time over the summer seemed feasible for all program directors. And lastly, we wanted parents to complete permission slips because we thought it was important that if they're involved in the library summer reading challenge, or they're participating in a camp that's been identified by summer reading partners, we wanted to be able to share their data with MNPS. So all that data included from the summer reading program's perspective was just their tracking data, tracking sheets on how often they read, what type of books they read, and then the cumulative data, how many minutes over the summer had they read. And we compared that to first and second semester test scores. I hope you all can see this, but in summer 2018, our summer reading challenge, we focused on 21 sites, about 1,600 young people participated. I'm sorry, I have this backwards. Let me go back. Okay, here we go. In summer 2018, we had about 15 summer reading sites, about 785 Nashville youth participated, and they read over 300,000 minutes. But keep that in mind as I move to this next slide, where we see an increase. We had 21 partners in 2019, 1,600 Nashville youth participated, which meant that doubled. About 642,383 minutes were read by our young people, meaning that more than doubled. We had 928 students actually sign up, 360,000 minutes read by MNPS students. And that just the difference between these two numbers is that the 642 minutes could have been a parent reading to a small child who couldn't yet read. So we allowed parents to track for 3 and 4 and 5-year-olds that may have been in summer camps, but were not included in MNPS data. And lastly, 381 students read, we had access to 381 students reading data. I think this is one of my favorite pieces of data to share or points to share, because we see with two different camps, and this is just an on-target camp. It was the name of one of our smaller camps. We had a control group that did not come to camp and did not read, and we matched them with a one-to-one peers for students based on demographic, age, and reading ability at the time. And we see that our students who read at least 660 minutes gained one full month of academic progress over the summer, while students who did not lost almost a month. I think that's just really important, because we've always heard the data that, that talks about summer slide and how stark the contrast is between students who engage in any type of literacy effort and those who don't. And this just proves it, at least here in Nashville. So 2020 came, and as Mr. Fairchild alluded, we had two back-to-back tornadoes that devastated some of the largest and most gentrified parts of our community, both hitting the affluent neighbors and some of our more disenfranchised neighbors. So we knew we need to shift, but that was even before we were hit by COVID and a pandemic that had us safer at home for 6 months. As we were preparing for 2020, we had almost 75 camps that had signed up. We were looking to host at least 5,000 students. I mean, we were looking for a phenomenal year, but we had to pivot, and we had to pivot quickly. There's a lot here that talks about what we call the virtual summer experience, but I want to focus mainly on this last statement. Our options are limitless, whether joining a Rise for Reading session, which is one of our camps, yoga, coding, you can join at any time, join as many sessions of their choosings daily. Our focus for MNPS, and specifically for the Blueprint, was to make sure that when we were able to re-engage students, that we were focusing or doing check-ins on their well-being and their health. So we know we need to engage in literacy supports, but we also need them to have access to a version of extracurricular activities that makes them feel connected to a loving adult. So we didn't want all of our sessions to be strictly academic focused. So for the month of June, we had Monday through Thursday content specialty camps that were all virtual. And then on Fridays, we did virtual field trips, one of which was to the Tennessee Safari Park, which kids loved, especially if a child has never been able to go to a zoo, or they love animals and those are their favorite books. This was a good way to get them out of the house while they're still safer at home. So I say all that to say we had very high hopes for 2020 summer, and we're looking to use some of the same road mapping that we developed for the fall and summer. So we still have over 100 community partners who have decided that they may be engaging in some type of programming, or they may be offering their buildings for small pods of children. And with that, we're going to offer the same types of supports: access to books. We're going to encourage them to read 20 minutes per day, and we are going to seek permission from their parents to compare data, because we want to make sure if this safer at home mandate has to be extended over a period of time, we want to make sure that we're doing so with the best possible practices and with the best possible data. So with that in mind, please follow us on social media to stay along for our journey. We're called Jump in Nashville on Facebook. You can follow us at Blueprint Nash 1 on Twitter or Instagram, and then feel free to visit our website, blueprintnashville.org. We're still a fairly new collective impact. We are so looking forward to what's to come.
Well, thank you, Christian. Really impressive ability to pivot there from clearly from an approach that was working in previous years to a new model. And we'll be eager to hear the kind of data that you get this summer, the levels of engagement. And I know there are going to be some questions that we'll get into. And so with that, I also want to turn it over to Jennifer Deemer. Jennifer, you want to share a little bit about your work in Wyoming Valley?
I sure do, Ron. Thank you first to the National Civic League and to the National Campaign for including us in this opportunity today. My role here at United Way of Wyoming Valley, I am the lead of our grade level reading work, and I have also overseen our strategic planning and all of our community investments and grant making opportunities. I've been with the United Way for nearly 7 years now. I'm also a mom to a rising first and third grader, and that last part is probably what makes me the resident expert in our organization. Our United Way has been a member of the campaign since 2016. As I told Ron earlier today, I'm very sad that we're unable to convene in DC as originally planned, as I participated in grade level reading week in Denver and in Philadelphia. And if you have too, then you know you've likely greatly benefited from the convening opportunities. Okay, so screen sharing, but nothing's happening just yet. Okay, here we go. So a little bit about our community. The Wyoming Valley is not really a town or a city. It's a geographical representation within Luzerne County that makes up several towns. Wilkes-Barre is the largest city in that comprised area. We are 2 hours north of Philadelphia and about 2 hours south of New York City. And we're also about an hour away from the Poconos. I chose this graphic on this slide because it helps quickly to identify our little purple county, which is standing alone among those in red, the ones that you would expect to see. This is also about COVID, to see heavily affected in the Philadelphia area. You can see them in a cluster. Northampton, Lehigh Valley are all in a cluster in purple, but we stand alone. And there's a lot of reasons for that that I won't get into today, but I did want to at least show you where Luzerne County is on our Pennsylvania map. And we are a small county of 317,000, yet we are number 11 out of 67 for the highest number of COVID cases. In terms of what has drawn us to the campaign for grade level reading, childhood poverty, and our community graduation rates were really the impetus for our desire to become a part of the national campaign for grade level reading. Of particular significance, the poverty rate in Luzerne County among children in the year 2000 was 14.7%. By 2012, that rate had skyrocketed to 29%, and it has really only come down 4% points since then. Our graduation rate overall is slightly below the state average, but within certain districts, it's actually in the high 70s. So those are really the main drivers for our work. And we have about 8 grade level reading programs around those 3 core areas of readiness, attendance, and summer learning. And the 2 that I want to talk to you about today are relatively new. One actually born out of the whole COVID crisis. When our school buildings were closed in March and we had transitioned to a distance learning model, we were keeping our ear to the ground to find ways that we could be supportive, especially while our programs were being suspended. And we hosted some virtual meetings with our school district partners and learned that the youngest learners seemed to be struggling the most. Some due to connectivity issues, while others found that distance learning was not translating very well for the very young students. In fact, one school district did not provide Chromebooks for kindergarten through 2nd grade students as it was not in the budget, and they felt it was really not the best tool to use for that age group. And that's when our United Way jumped into action and said there's got to be something that we could give these students that would be meaningful and helpful during this time. So we decided to find a vendor that could mail workbooks directly to this group of students. And the workbooks could be used then during the summer months just to keep the kids engaged in practicing their critical literacy skills and math skills and their motor skills too. So, you know, working digitally and virtually is one way, but we want kids to have a pencil or a crayon in their hand too when they're that young. So we researched vendors. There were really only 2 that did that type of work, Scholastic being one and Highlights being the other. When it came down to selecting a vendor, we chose Highlights. Price was a factor, yes, but Highlights, most people may not realize, is a Pennsylvania-based business. They have their roots in Honesdale, in Wayne County, which is part of northeastern Pennsylvania, and so is the Wyoming Valley. So our board really favored that approach. So here's a little bit about some of the statistics of our workbook initiative. We engaged 12 school districts and 24 school buildings. A total of 5,946 workbooks have been sent out. The partners included United Way, of course, as the liaison between all of the different aspects of the project, and district reps. Of course, each person from the district had to help us along in terms of planning and then getting their information together and sent to highlights, which we specifically requested we not be involved, so that we limited the third-party contact with that type of sensitive data. And then Highlights Magazine was unbelievably supportive, and not just because they were going to get business to serve 5,900 students, but because they really genuinely cared about the effort and they were really excited to be part of it. And they had to organize information from 12 different school districts to make sure that everything happened seamlessly. Then we went out and did a fundraiser specifically for the program, and I showed those logos just a minute ago of all these. Some of these are national and some of these are local family foundations that really said, yes, I want to align with that project, and you could see what the cost of that project was. It was not cheap. And we also did a cover letter to explain to families what it was that we were trying to accomplish, so that when they got this magazine, they didn't have an expectation that there would be a cost involved. But you'd be surprised how many people don't read the cover letter and call and say, I didn't order this. So that's okay. For evaluation purposes, we're going to reward students that complete a workbook with ice cream, and we think that's a terrific motivator. We also recorded a video and put it on our website, and we've asked parents to click on that video and try to explain to them the reason that we did the project and how important it is for them to help their children along. But if they themselves get stuck, we even have a phone number and an individual who's going to be able to assist families with completing some of those workbooks. Now, since the project launched, PNC, which was a funder of this initiative, has now come back and said, look, we really want to find a way to reach the pre-K bucket, if possible, going in a similar direction, and maybe even something more year-round for these pre-Kers who may be disconnected to their classrooms. So now they're going to launch a partnership with us so that we can continue that good work with Highlights Magazine. So we're really, really excited about this project. And then the other program that's still new to United Way is called See to Succeed. This was a new initiative slated for a March launch, but it was thwarted by COVID. But our partners are still on board, and we are still very, very eager to begin again this fall. See to Succeed was born out of one of our other school attendance programs called the Nurses Pantry, which provides material goods to school nurses to keep kids in school, basically clothing, hygiene, lice kits, all of those types of things that kids could be missing school for. We give each school building a budget, and we ask the nurses if they would please purchase the items with those dollars. If not, we try to purchase for them and have them shipped right there. Well, one of our participating school nurses reached out to us last year and said we would like to know if we could use some of our budget dollars to buy a spot screener, which is a device that quickly digitally screens children for vision. And they said, it would help us get through our screenings. They have 7,000 students in their district and thought it would be a much more efficient way to do screenings. And we took some time to understand that reason and need, and we agreed that while it would be no problem for purchasing equipment, it was clear to us fairly quickly that it would likely not change the results for children, which was a pattern of children identified as in need of vision correction, but not actually getting glasses. So we formed a group of partners to really brainstorm ways to change the outcomes. And that is really how See to Succeed came about. It's a simple concept, but one that will change the trajectory of learning for children in need of vision correction. And how it works is really simple. The school nurse is going to conduct their annual vision screenings using the spot screener, which they did over the last school year. Then students who failed the initial screening are then invited to participate in the program. We have a licensed optometrist and optician to provide the comprehensive eye exams in the school setting, which makes it very unique. And then students who are prescribed glasses get to choose their frames from a wide selection of styles and colors right there on the spot. So we started this pilot last fall in the Wilkes-Barre Area School District, which is the largest district in our footprint, also the most economically disadvantaged. And the nurses screened 5,753 students. Of that amount, 702 failed their school screening. And then they send out a note to the parents who are supposed to have the child seen by an optometrist and then return the form to the nurse letting them know what the outcome was. Well, as you can see, of the 702, there's still 588 that still have unmet needs. And that's really the reason why we launched See to Succeed, because this was a pattern in school year 18-19 as well. So that's when we send out a permission slip now to say, we want to include you in a unique program. It's our first year trying this, and out of the 588, 105 parents with some coaching, which I'll get to that in a minute, agreed to have their child participate in See to Succeed. So what that really entails in terms of getting that all to happen is we need some project partners and we need some really dedicated people to participate. So besides ourselves, which we are very key to this program because we have the relationship with the school districts, we started working with the Right Center, which is a federally qualified health center. And they also are very much involved in school-based health centers in other districts where they've actually created community-based and school-based health centers that the students can use for their primary care needs as well as the community. They come in through a different entrance into the school building, but they've really established a standalone way of addressing school-based health needs. So they had a vested interest in doing this project with us. So they said, sure, we'll sign on. And then they were the ones who hired a part-time health professional who's going to accompany the optometrist to the schools, you know, basically make sure that everything is flowing smoothly. They contact parents in advance for benefit information. Then they verify the students' benefits with insurance companies. Not surprising, most children are covered by their state child's health insurance program or Medicaid. And the optometrist and the optician do the billing as they would as if that student was in their own office building, or, you know, as if they were a regular patient. They will then bill the insurance company for reimbursement. However, we know that there are certain students who do not have Medicaid, or maybe not yet in Pennsylvania, because we have a transient community coming from New York and New Jersey, that they haven't transferred their Medicaid benefits yet into the state, and or for whatever reason they just don't carry insurance. We have some dollars set aside to cover the cost of the and underinsured for both their exam and for their glasses. The Right Center was also responsible for purchasing the equipment, which was extremely expensive. It's mobile technology. It's taking the lane and everything else that you would expect in an optometrist's office and making it so it could fit in a suitcase. It's absolutely incredible, but also very expensive. They also developed a unique parent permission form, and that needs some tweaks too because parents ignored some of these forms that came home. So then we had the part-time health professional reach out to them and explain to them, this form came home, and this is a really great opportunity if you're seeing barriers for getting your child to the optometrist for a visit. And just that touch base alone had built confidence in the program too. And then, of course, the Right Center is also the contractor with the optometrist and the optician to reimburse for that and underinsured care. So while the optometrist and the optician can bill the insurance company, they will bill the Right Center for charity care, and United Way is going to really just cut the checks because we do not have the liability insurance to cover those types of reimbursement relationships directly with health professionals. And last but not least, the Moses Taylor Foundation is a significant health foundation in our community, but stepped right up and said, we want to be part of this groundbreaking work, and they funded us $143,000 for the 2-year pilot program. In the year 1, they're covering really the equipment cost and staffing, the part-time health professional, some of our time here at United Way to keep our arms around everything, and then the charity care for the underinsured. And then in year 2, it will mostly be staffing and care for the underinsured. At that point, the FQHC, which has extended its application now to become a look-alike, which is very challenging to explain in a very brief time. What that means is basically they will be able to offset some of these expenses as well as a FQHC, and United Way is committed to the program too. That's really the recipe for the program, and the evaluation process is going to be pretty simple. We're going to randomly select a certain number of children from each grade, and we're going to ask the teachers to report on any improvement in their learning over the school year. And we truly realize that this program is going to make a significant difference for children, and we are eager to get back into the classrooms and start our rotating, school-based rotating eye clinics. And that's my presentation.
Jennifer, thank you so much, and I'm so glad that you shared a little bit about the vision issue, and we know that there's so many health determinants of early school success, and vision is obviously a critical one, and I'm so glad that you shared that in addition to the work that you're doing with Highlights Magazine. So wonderful. I think from all 3 of our communities today, you heard real solutions to some of the huge challenges that we're facing, and I shared a little bit about some of the stories that they shared today. There are many of them available on our online learning platform that the campaign has launched, clipglr.org. I posted that in the chat. You can feel free to search our interactive map and click on any of our communities and hear a little bit more about what's going on. I'm eager to hear if there are questions. I certainly have a few myself in the time that we have remaining, but Rebecca, did you pull anything from the chat that in terms of questions from those who are on the line?
I did. I'm just going to stop sharing my screen real quick so I can pull those up. The first question, I believe, was answered in the chat, but just in case anyone wasn't following it, I wanted to have Beth address that to everyone. The first question was, are there any examples of kits being implemented in summer library programs, i.e. small 8 to 10 person kindergarten readiness program for 4 to 5-year-olds getting ready to enter kindergarten in the fall that utilizes the library as a meeting place as 1 to 2 educators who facilitate?
Yeah, thanks for that question. I love the thinking and the sort of innovative approach to potentially deploying kits in other environments. We have not tried that yet, mostly because a goal of kits is to help the kids get familiar and connected to the school and the parents as well, so that by the time they start school, they already have a developed relationship with the teachers and staff there. So that's mainly why we've stuck to the school-based environment. But again, with COVID, sort of all bets off the table. And so we're really entertaining all different kinds of environments to do that in. But that's been the main driver for sticking to the school-based model.
And Beth, also one. Oh, go ahead, Rebecca. Sorry.
Sorry, I just had another question for her while we had her on the screen that I wanted to address. Another question about kits came through. How are the topics for the parent support / education groups determined? Is there a set sequencing that you have found to be the most effective?
Yes, so the developers of the KITS program also developed the parent group curriculum as well. They are sequenced together so that as the kids are learning the new skills, the parents are also being instructed on those. And it's mainly so that they can take home that information and practices. A big component of KITS is allowing enough time between the classes so that they can practice it at home and sort of embed it into their family environment. And so the parents are getting a lot of instruction about why those skills are important and how to practice them in the home environment and encourage it in the school. And a big component of that is shared language. And so the kids are learning the certain buzzwords and phrases that the teachers use. The parents are using them as well, so they can reinforce the instruction. So by the time that they get to kindergarten, the kids have a whole set of phrases that they use that they have been taught over time and used at home. One of them is like, oh, I can't get my way. Oh, well, maybe next time. And it's like you can almost identify a kids because they use that phrase, oh, well, maybe next time. And it gives them a chance to move on from sort of their fixation on whatever it is that they want to have of their own. So that's so the parent curriculum and the child curriculum is very much sequenced together.
Well, one thing, Beth, is sort of reflecting on your presentation. I mean, there are very few communities that are going to be able to secure the resources to do 3 randomized control trials and do all of this new program development around an effort like this.
Okay. I've got it right here for you.
I think one of the things that I was going to suggest to folks is, rather than, I mean, this is that point about reinventing the wheel, right? I mean, you can extract practices and strategies and resources from other communities that have done great work and rely on their evidence base. And so that's really critical.
Yes.
Jennifer and Christian, I was curious, both of your models have involved kind of a transition to virtual or remote, whether you're mailing books to folks or, solving issues around devices and connectivity. I'm curious what you've learned about engagement, because we know in talking with other communities that, a lot of places are struggling with not being able to get, a large number of their kids and families engaged in these kinds of efforts of remote learning. And I'm curious if you have any early learning around that issue that you might be willing to share with folks.
Well, I'll just jump in really quickly to say that our experience goes like this. So we asked the schools to send out a notice to their families that they would be receiving the workbooks and would not be caught off guard. Now, as I mentioned, we put a cover letter in there to explain it. Some people do not take the time and they just call right up and say what they have to say. But we received multiple phone calls from parents who did not receive this workbook they were expecting. And it was related to the fact that they did not have an accurate, or a current, I should say, address on file with their school building. And, they wanted what they were supposed to get. So we found out that people are listening, which was great, because sometimes the schools were saying we couldn't even find families for the last quarter of the school that was distance learning. We just couldn't get them to participate. They wouldn't sign on. They told us they had, issues, and they were lost to us. But what we found was when they were told they were about to receive something and didn't, it's when they reached out. So they were listening, which we thought was really a good thing. In terms of engaging, well, we're going to find that out when we get the workbooks back, or we don't get the workbooks back, and we will evaluate our decision about that program going forward based on the return. But the schools themselves have told us that parents are really happy to have something in their hands, because that district had not mailed out a single thing to families. They were just relying on technology alone. And they felt that was a lot of the distance there. So they were thrilled that we actually could give them something pencil and paper related.
Yeah,
And
absolutely.
For us in Nashville, it was really a heavy focus on, community partners and just the sense of community. I mean, we had a little bit of a trial run in community building with the devastating tornadoes that came about a little over a week before we closed down completely for the year. So we'd had several hundred families displaced because the tornadoes hit down in about 3 or 4 zip codes. I mean, it just devastated neighbors. And so we'd already set up hubs or distribution hubs at area churches and some of our area nonprofits. So when we moved to the Safer at Home mandate and we had to clean out our offices, we had to be home, a lot more of our nonprofits were used as holding spaces. So we just collaborated in a way and made sure that book distribution on bus routes that for all of the different materials, like, handing out laptops to our students, that when we handed those out, we handed out meals as well. And we handed out a schedule of events for teachers or for schools or for whole clusters. And by clusters, I mean the elementary, middle, and high school that follows, that a neighborhood student would go through. So it was really leaning in hard in a best practice of having, meeting families where they were, having a one-stop shop for everything. So if families needed an increase in SNAP benefits or EBT supports, any kind of government assistance, we took resources there and allowed them to pick up the laptops for school, allowed them to pick up books that were donated. I mean, we tried to make sure families didn't have to go a bunch of different places to get the resources that they needed. And we're hoping that will carry us over fall, and maybe even do what summer can be a second way.
Yeah, and I think that Christian really underscores the importance of the relationships with parents and connections, and reinforcing this idea that parents are essential partners in education. And certainly the crisis that we're in now really emphasizes that. And if we don't have good address information, if we don't have really strong relationships, that's really going to compromise, our ability to be effective. And, I just want to commend the three of you for really great work. And, I think one of our shared concerns is that this COVID precipitated learning loss could be an enduring legacy of this pandemic if we don't step up and really do a lot of hard work making sure that these setbacks are part of our recovery plan, that we build back a whole lot better than where we left things. And, I know that as it relates to Wyoming Valley and Lane County and Nashville, it's certainly in really good hands with the leadership that all of you are providing. So again, thank you for being willing to share your successes and challenges today. And with that, I'll turn it back over to Rebecca.
Great. Thank you so much, Ron. And also a special thank you to Beth, Christian, and Jennifer for taking time out of your busy schedules to share the inspiring work that's going on in your communities and how we're all working together to mitigate that learning loss that COVID-19 has presented us with. I also want to thank everyone who attended today. For those of you familiar and not familiar with our work here at the National Civic League, we thank you for joining us. We hope you'll stay connected with us and join us for future webinars. We have these once a month on a range of topics. I will again be sending out a follow-up email that's going to include the slides, a recording, as well as some of the resources that were dropped in the chat throughout the webinar. And then we'll also send you guys a brief survey just to get some feedback on how we did and how we might improve future webinars. So please take a couple of minutes to fill that out if you can. And with that, I want everybody to have a great rest of your day, and we hope you will join us for a webinar sometime in the future. Thank you, everybody.
Thank you.
Thank you.